Hello and welcome to week 3 of PUBH 610. Today we will continue our discussion of the healthcare system in the United States, but our discussion will focus on the evolution of how the healthcare system has changed over time. The learning objectives for this week are to understand developments that shaped the U.S. healthcare system and why the system has been resistant to reforms, to provide a historical perspective on the ACA, and to discuss prospects of new healthcare reform efforts. The U.S. healthcare system has been shaped by a series of good intentions, compromises, and incremental changes, as well as our anthrocultural values, social, political, and economic factors. Over time, the U.S. healthcare system has gradually shifted from a mainly private system to a combination of private and public programs. As public health professionals and/or concerned citizens interested in the current debate over healthcare reform and how best to provide high-quality care for all Americans without financial hardship for individuals and the country, knowing the history of how healthcare evolved is important so that we can learn from previous mistakes and history doesn't repeat itself. Healthcare in America lagged behind most European countries during the pre-industrial era. Rather than emphasize research and medical science, Americans at the time embraced natural history and common sense. There was no health insurance at the time, so patients would purchase healthcare with their own money. These 5 factors explain why the medical profession remained an insignificant trade in America during the pre-industrial era. The medical profession was essentially a free-for-all, where almost anyone, regardless of medical training, was able to call themselves a doctor. Your book provides a fun fact that the red and white striped poles seen outside barbershops were signs, red for blood, white for bandages, that barbers also functioned as surgeons and would use the same blades to cut hair, shave beards, and bleed the sick. Speaking of bleeding the sick, medical procedures during this time were primitive, and hospitals were few and far between. Almshouses, also called a poorhouse, took in the poor, sick, needy, and insane. These hospital-like institutions took care of people who were poor and didn't have families to care for them. Hospitals in the early days were unsanitary places with few resources, poor ventilation, and poorly trained staff. People went there as a last resort, and the wealthy avoided hospitals. Furthermore, there was weak demand for doctors during this time because people took care of their sick family members, and many families were too poor to pay for a doctor's care. This was unlike in Europe, where governments in Europe financed and regulated medical education. In the US, medical education was private, and overall the quality of medical education was substandard. During the post-industrial period, healthcare as we know it today began to take shape in America. As the economy shifted from one rooted in agriculture to industry, employers began providing workers' compensation and factory workers for work-related injuries. This led to the development and growth of private health insurance in the United States. Also during this time, physicians gained power and prestige and became an organized medical profession. The Great Depression set the stage for the development of private health insurance in the U.S. Unemployment was high, income disparities and access to health care was getting worse, yet medical costs were rising. At this time, a national survey found that unemployment and low wages were associated with chronic illness. During the 1930s, health insurance began to take shape in the U.S. The Baylor University Hospital Plan provided public school teachers with 21 days in the hospital for 50 cents a month. This provided the model for Blue Cross hospital insurance, which would go on to become the dominant form of health insurance for decades in the United States. The American Medical Association continued to oppose insurance because it feared that it would interfere in the sacred relationship between patients and doctors. They just urged patients to save for sickness, which we know does not work. During the 1930s and 40s, private health insurance continued to grow as the government exempted health insurance benefits from wage and price controls and from taxable income. During this time, insurance companies were allowed to raise premiums without having to control costs. In 1935, President Franklin D. Roosevelt signed the Social Security Act into law. This law, which set up our Social Security system, also provided federal aid to states for public health, welfare, etc., and it set the legislative basis for most welfare programs, which followed, such as Medicaid and Medicare, which were amendments to the Social Security Act. In 1965, President Johnson signed the Medicaid and Medicare Act, which was the most significant health reform of the 20th century. Two factors that helped Johnson get this legislation through were that he had the support of hospitals and insurance agencies. One of the reasons the hospitals and insurance agencies supported this was because there were no cost controls or physician fee schedules as a part of the bill. This created a scenario where the government was now responsible for financing healthcare for two large populations in the U.S., the elderly and the poor, and there weren't any cost control mechanisms in place to prevent runaway spending on healthcare. Because Medicare and Medicaid are such large and important healthcare programs in the U.S., I want to make sure you understand what they do and don't cover and who they serve. Medicare has 4 parts: A, B, C, and D. Only parts A and B were part of the original legislation signed by Johnson in 1965. Part A is hospital insurance, which also covers post-hospitalization home care and short-term skilled nursing care. You are eligible for this coverage if you're over 65 and or disabled. This coverage feels free, but really you paid for it in payroll taxes, as you must have worked for 10 years and paid into the system. Part B covers physicians' bills and select other outpatient services. For this coverage, you must pay a premium, aka a monthly fee, and in 2019 the premium was $135.50. And after you meet your deductible, people typically have to pay 20% of the Medicare approved amount for covered services. Medicare Part C is also known as Medicare Advantage. It is a voluntary private insurance plan which combines the different parts of Medicare under one private plan to simplify coverage for beneficiaries. But under this streamlined service, beneficiaries have to pay a premium, and there is a debate about whether this coverage is actually advantageous or if you're better off with basic Medicare coverage. Medicare Part D is the prescription drug coverage plan. I remember this because D is for drugs. This was passed in 2003 by President George W. Bush. This program is also voluntary, so you don't automatically receive prescription drug coverage unless you sign up and pay for a premium for this. Under Part D, there were significant gaps in coverage called the donut hole. The ACA attempted to close these gaps. Please watch the short clip which I've posted on Blackboard on the different parts of Medicare and the donut hole to make sure you understand this program. What I want to make sure you understand is that while Medicare is one of the most popular federal programs, it is very complex and full of flaws. Many people think that once you turn 65, you no longer have to worry about healthcare costs and the government will take care of you, but it is much more complicated than that. As we discussed last week, Medicaid is a joint federal-state program which provides health insurance coverage for low-income and disabled adults, children, and older Americans who need long-term care. The federal government sets broad guidelines, but states design, implement, and administer ultimately independent programs. States may add optional benefits or extend coverage to higher income groups. The Affordable Care Act attempted to raise Medicaid eligibility in all states to 138% of the federal poverty level, but the Supreme Court struck down this mandate in 2012, and expanding Medicaid became a state's decision. Eventually, 31 states and DC did expand Medicaid coverage under the ACA. Another important piece of legislation which shaped the U.S. healthcare system was the HMO Act of 1973. Originally in the United States, corporate practice of medicine was prohibited, but by the mid-1900s, the healthcare landscape had changed, and physicians were practicing in specialty groups, and prepaid group plans began enrolling employee groups with capitated fee arrangements. This means that these employee groups would pay a fixed monthly fee in advance and receive comprehensive health services. Kaiser Permanente is an example of a prepaid group plan. The employment of physicians by certain industries and group practices with capitated fee structures were the origins of managed care organizations in the United States and health maintenance organizations. Nixon signed the HMO Act of 1973 to stimulate the growth of HMOs. Federal funds were given to support demonstration projects across the country. This was done because it was believed that prepaid medical care was an alternative to fee-for-service, and it would stimulate competition among health plans and improve efficiency and control the rising cost of healthcare. The act required employers with more than 25 employees to offer an HMO alternative if one was available in their area. The act aimed to create 1,700 HMOs and enroll 40 million members, but they fell short, and by 1976 only 174 HMOs had been created and 6 million people were enrolled. Ultimately, employers did not take the act seriously, and they continued to offer fee-for-service insurance until their own expenses started to grow rapidly during the 1980s. Ted Kennedy, Nixon, and President Clinton all tried and failed to pass national health insurance plan reforms. But in 2010, the stars aligned, and President Barack Obama narrowly passed the Affordable Care Act. These 6 factors facilitated its passage. The Democratic Party had the majority in Congress and the presidency. Another reason was that the American public had little to no participation in developing the legislation. If they didn't know about it, they couldn't fight it. Fourth, they overstated the benefits and made it sound as if all Americans would be covered and protected from high medical bills. This was not true. Fifth, industry representatives supported the bill, and lastly, in 2008, the country was in an economic crisis, and President Obama tied his healthcare reform plan to economic growth. This was a strategy that ultimately worked. The ACA was passed in 2010, but various provisions were implemented over time. The legislation had 4 broad goals: providing new consumer protections, such as no more mini-med policies, improving quality and lowering costs, such as the 10 essential health benefits, increasing access to affordable care through Medicaid expansion, and holding insurance companies accountable. This was aimed to prevent companies from denying those with pre-existing conditions for coverage. Unfortunately, the ACA wasn't perfect. While the number of uninsured decreased largely due to Medicaid expansion and income-based subsidies to aid in purchasing coverage, many Americans did not benefit. A large part of the middle class was upset because either their insurance didn't comply with the new rules under the ACA, and therefore they lost coverage. People were forced to purchase coverage through a health insurance exchange. But unfortunately, the exchanges weren't popular. They had few choices and high insurance premiums. In 2016, three of the largest health insurance companies, Aetna, United Health, and Humana, announced that they would not continue selling plans on the exchanges. And in some states, this meant that only one insurance company was now available on the exchange. This set the stage for the election of Donald Trump in 2016 and the push by Republicans to repeal and replace the ACA. Since the ACA was implemented in 2010, national polls showed that the country is split 50-50, half in favor and half against the ACA. Small businesses were particularly hurt under the ACA as they were forced to provide coverage for their employees. Within hours of taking office, President Trump signed an executive order which suspended the collection of penalties under the ACA for not having health insurance. This ended the individual mandate. As we look toward the 2020 elections, health reform is again front and center, with some people pushing for Medicare for all or a single-payer, government-run health insurance program, while others want to roll back the ACA and limit the government's role in healthcare and reduce the welfare state. In summary, the current healthcare system in the United States is the culmination of 150 years of history. Rather than a government-sponsored health insurance system similar to what developed in Europe, the U.S. grew a largely private insurance sector and then attempted to fill gaps in coverage with large federal programs like Medicare and Medicaid, and most recently, the ACA. But unfortunately, all of these measures have failed to provide universal health coverage and fail to recognize health as a human right. Only time will tell if we can achieve universal coverage through incremental change, such as the ACA, or if something more radical is required. That's all we have for this week. See you next time.